Hi, welcome to the Facebook Live event, Healthy Minds and Gut. My name is Jamie Lee Connor. I'm the Senior Manager of Community and Support at the Crohn's and Colitis Foundation. Before we begin our event tonight, I just wanted to take a moment to thank our sponsor, Takeda, for supporting this event. I am welcome today with two speakers, and I'm going to go ahead and introduce you to them. I am so excited to introduce you to Dr. Stoeckel. She's a pediatric psychologist with a specialization in treating youth with chronic gastrointestinal conditions. She received her bachelor's in psychology from Harvard University, her PhD from American University, and then she went on to pursue specialized training in pediatric psychology at Oregon Health and Science University. She also completed her residency and fellowship there as well with a focus in GI psychology. She's now a pediatric GI psychologist and assistant professor at the Yale School of Medicine, where she is fully embedded in treating GI-related conditions. I also am welcomed today by an IBD patient and Power of Two mentor, Marisa Dourlain. Thank you both for joining us so much today. So before we get started, I wanted to go over a few quick housekeeping pieces before we begin. So today's chat is truly meant for educational purposes. The only views we share today during this chat, they're not meant to represent the official position of the foundation. And we always encourage you to consult your physician or your provider before making any changes to your IBD treatment regimen. If you have any questions or concerns today related to mental health, we'd encourage you to reach out to our IBD Help Center. You can contact them by emailing info@crohnscolitisfoundation.org, or you can call 1-888-MY-GUT-PAIN. So with that said, we're going to go ahead and get started. And first, I'm going to turn it over to Dr. Stoeckel. And I really wanted to ask you today, what do you think is the importance of maintaining a healthy emotional well-being for someone that has IBD? And I also wanted to ask if you'd mind sharing with us why it's so important to learn about balancing emotional well-being and health.
Great questions, and thank you to everyone for having me. I really enjoy being a part of this community. We have learned so much about the importance of mental health and the impact that it can have on managing a variety of chronic health conditions, but particularly IBD in recent decades. Historically, there's often been a total separation of medical services and the psychological services. So for example, you might go see your gastroenterologist and have your appointment, and then you might only be, and this is in the past typically, that you might only be referred to a mental health professional if there were truly glaring symptoms of depression, anxiety, or other severe mental health issues. But we've seen in the field of health psychology and pediatric psychology, which is where we specialize in chronic health conditions like IBD, that we now really value what's called interdisciplinary care, where as a patient, you might meet a mental health professional, so a social worker, a psychologist, a licensed counselor, truly as a part of your gastroenterology team. And I think this really shows how much we value that as a society in managing the ups and downs that can come with IBD. So I know I'm biased because I'm a GI psychologist, but I really believe that having mental health tune-ups is just as important as having a routine GI visit, because it's not either or. You have to be managing all of it at the same time to be your best self.
Yeah, and it sounds like there's so many reasons for us to not only maintain and balance our emotional health, but particularly for IBD patients. And that brings me to my next question, which is, what are the implications of anxiety and depression for a patient that has IBD?
Yeah, great question. I'll try to give you like the Cliff Notes version on it, and but I think there's so much both clinical and research work being done to kind of answer that question. But we know that having symptoms of depression and anxiety, they don't cause IBD by any means, but they can definitely make it really hard to manage IBD because it's so challenging. So for example, if our mood is low, we might not be able to cope with our GI symptoms as well. We might not be as up for managing our treatments as well. It just can impact everything. It can just be really hard to handle the inherent ups and downs that can come with having the unpredictability of IBD. Like, I often talk with my patients about how the only predictable thing about IBD is that it's unpredictable. Sometimes we have to learn to lean into that. So all of, in terms of depression, all of the kind of the symptoms of depression, or we might withdraw, can make us withdraw from our treatments and make it, of course, hard to manage IBD. In terms of anxiety, I like to think about it in terms of the gut-brain connection. And this is where I nerd out a little bit because I like thinking about the nervous system. So I'll try to be brief with it. But the gastrointestinal tract actually has its own nervous system called the enteric nervous system, and that's connected to our brain. So it has a lot of power, for better or worse, in any GI condition, and IBD is one of those. So if you think about it from a nervous system perspective, whenever our gastrointestinal tract is stimulated by a flare, for example, that impacts our brain, and vice versa. If we experience stress or anxiety, that also impacts our GI tract. So we might have exacerbated experiences of flares if we're also experiencing anxiety and stress. And I can see Marisa nodding her head, so I'm looking forward to hearing from her about this. So, I think my take-home point is that it's really important just to know our own cues about our mood and anxiety symptoms, so that we can kind of be aware of what's going on and what we need to take care of mental health wise to help manage our IBD.
Yeah, and I totally can see Marisa too, right? Shaking her head. She knows what that's like, learning how to manage all the stressors that come with having IBD and just learning to live with it every day. So what would you say, Dr. Stoeckel, that, we're talking about anxiety and depression, but how do people learn to cope with anxiety and depression while having IBD? Do you have any strategies you could share with us?
Yeah, I'm happy to. I'll share a few tips that come to mind. I also say with a caveat that this is not meant to be a replacement for seeing a mental health professional, but there's definitely some go-to strategies that I commonly teach to people that I think can be good to have in your back pocket. One that I often teach is called the Postit exercise, and the purpose of this is to help us come to a place of adaptive acceptance of our IBD. So I have a Post-it here, and I find that this is really hard to demonstrate on Zoom because you can't see my whole body. So you might have to use your imagination. But if we have a Post-it, and if I had a patient in my room, I would have them write down something that they're afraid of about their IBD. So that could just be having IBD in general. So, a patient might write IBD on their Post-it, or managing my ostomy, or going to school and not knowing, so whatever the fear is, they would write it on their Post-it. And then I'd ask them to hold it as far away from their body as possible. So if you can see my arms, my arm is straight out. And I would literally do the same thing and sit there with them. So you want to hold out the Post-it and try to keep it as far away from you as possible. And then we would just sit with that for a minute or so. And then we would reflect together. How's your arm doing? How's your shoulder doing? What are you noticing? And, I work with kids and teens, and they're usually kind of funny about it. Say oh, it feels like it's going to fall off. We kind of joke about it, but then we really reflect on, man, my arm is really tired. This is requiring a lot of work to keep this as far away from me as possible. So then I would say to that person, what would happen if you just, it has a sticky part, just put it on your shirt, just keep it here. What would that be like? How does your arm feel now? And you notice, okay, my arm actually feels much more relaxed. I can just let it sit. I can put my hand on my leg, and yeah, that does feel a lot better. And then we'd reflect together on what if we tried to do that with your fear, your IBD, whatever the fear was that they wrote down. And we talk about that this is an analogy for how, if we can move towards acceptance and kind of leaning into our fears, that it actually takes a lot less energy. That doesn't mean that it's easy, right? So I also talk about, I don't mean to minimize the distress that the person is experiencing, but by working towards acceptance and identifying ways that we can make that work, we usually feel a lot better. So that's one of my favorite kind of lead in strategies for talking with patients, particularly when they've been newly diagnosed. So everyone can try that one at home. There's a couple other that I usually teach people pretty early on. The first is, well, I guess these two are related to just the general concepts of cognitive behavioral therapy, or CBT, where we think about how our thoughts, feelings, and behaviors are all connected. So in terms of our behavior, we can use our behavior in our best interest to help to manage mood and anxiety symptoms. So when we are feeling depressed about IBD or something else going on in our life, we're less likely to do things that make us happy. And then it's a vicious cycle, right? Like the worse we feel, the less stuff we do, the less we see people that we care about. We get very isolated, and it's like a self-fulfilling prophecy. So behavioral activation is a fancy term for having scheduled pleasurable activities. So scheduling things that make you happy. And that might sound super simple, but when we're having mood symptoms and when we have IBD and when we have the two together, we forget about those things. So I often talk with people about, why don't we set some alarms on your phone to remind you to do these things, and then reflect on what are some things that make you happy that are pretty attainable at the stage that we're at. So that might be like making plans with friends. It might be, going for a walk or calling a friend, or, going on a spa day for yourself. Whatever, everyone has different things that make them happy, but just making sure that you schedule that in, even if you don't want to do that at the time. Because when you're not feeling well emotionally, these are not things that sound like you want to do them, but we know deep down that they do make you happy. So that's kind of one other category of strategies that I often talk with people about. The last category is related to how we manage our thoughts related to our IBD. So for all people, but particularly when we're managing a chronic health condition like IBD, we can have these thinking errors or cognitive distortions that come up. So they're like mental shortcuts that we take when we're not feeling well emotionally. And they're not always wrong or totally destructive, but when they dominate our thinking, it's when we can feel really distressed. So for example, a lot of patients I work with will say things like, my IBD is acting up, like, this is going to be the worst day ever. And think about starting your day like that. That's horrible, right? And if you start your day like that, on a day-to-day basis, you're setting yourself up for having a crummy day. So I work first with patients on identifying that that's happening, and then labeling it. Like, okay, I think this is a thinking error, and we question the evidence that we have for that. Like, what evidence do you have that this is going to be the worst day ever? Is that a little extreme? Like, how could we revise that sentence to be a little more based in reality and be a little more accurate? And usually when I have this conversation with people, they're able to identify all these other thinking errors that seem to happen. And they usually reflect, like, I've been doing this for so long, like I didn't even realize it. And now, we all have these errors. So I think I also want to normalize that, but it's when we have IBD, sometimes these errors can get like mixed in with reality. So we don't know what's what. So that's just another kind of concrete exercise that I do with people. And I think, if people in the audience are interested in learning more, I encourage you to check out the Crohn's Colitis Foundation website. There's a lot of resources. There's resources specifically to identify GI psychologists, because I know it's a different way of thinking about mental health. And there's the Rome Foundation is, I think, on the Crohn's Colitis Foundation website, and that is a group of us GI psychologists nationally who specialize in this. So there's lots of us out.
I love all those tips. And what I really liked about it was they're really easy tools to integrate. Like, it's something that every one of us can do into our daily life. And I think it goes, like you said, right? It's like beyond an IBD patient, right? We all have the ability to have some of those thinking errors that you talked about and get caught up in some of that vicious cycle. So these are great takeaways. And I really love that we can all leave here today and apply them in our daily life pretty easily. Thank you for that. So I wanted to turn the conversation over to Marisa, because I think it'd be really helpful to hear from you, Marisa, what your IBD journey has been like. And then we're also gonna want to hear a little bit about how you've learned to navigate some of that IBD journey. That I know I'm familiar with your journey. So tell us about your journey to start and what it's been like for you.
Yeah, absolutely. And thank you so much for having me here today. It's such an honor to be able to talk about it and to share my experience with others and hopefully help them along the way. So kind of going through my journey, and I apologize if I'm a little long-winded because this goes back to 2000 when I was only 14 years old. I was originally diagnosed with ulcerative colitis, and that was after about 12 to 18 months of being undiagnosed with pain and fevers and, all of these symptoms. But once we figured it out after that stretch of time, we found the right medication, and I was lucky enough to go into remission for almost 7 years. I was an athlete in high school, which I think really helped. I was able to keep my body moving. I kept my diet in check. And, to be honest, there were times when I forgot I had a chronic illness at all. So that's how well maintained it was. When I got to college, things kind of changed. This was long before the let me Google that was part of our daily, nomenclature. And so I never really did much research on colitis or IBD because I didn't feel the need to. And nobody really sat me down and explicitly told me what could happen if I acted like every other college student in America. And turns out when you drink a whole bunch of alcohol multiple times a week, you get no sleep, you eat junk food, it starts to catch up with you. And so my junior year of college, things kind of went in a serious way where in 2007, I had to have my entire colon removed, and a J pouch was created at that time. Shortly after surgery, my doctor did discover that I actually had Crohn's and not colitis, which isn't unheard of. But I did really well with the J pouch and experienced minimal Crohn's symptoms for almost a decade. So I did really, really well after I had that surgery. Fast forward, and between August of 2018 and August of 2019, so in a year span, I experienced another really serious flare. I struggled with fistulas that were brought on by Crohn's, and they just wouldn't heal. Even after 5 surgeries and different medications and biologics to try and, course correct, it just wasn't getting better. And so by September of 2019, I had that kind of coming to Jesus moment with my GI and with my surgeon. And I had kind of hit my breaking point. I was ready to just move on with my life, be, done with the hospitalizations, the surgeries, all of it, and regain my quality of life. And so we went from taking my ostomy at the time that was supposed to be temporary and making it permanent so that we could remove those fistulas and anything that was damaged, near them. And I am happy to report that since my surgery on November 26th, 2019, I have been in remission. I have been unmedicated. I have had no surgeries, no hospitalizations, nothing since that date. I made a choice that year for my physical well-being, for my mental well-being. And it was a difficult choice to make, but I decided that living with an ostomy was way more important than really dying with my vanity at that point. So I would do it all over again in a heartbeat, not a second thought to it. And so now here I am today. I have a job that I love in IT that enables me to travel around the country on a pretty consistent basis. I have friends and family that I'm able to go out with and have fun with, and I don't necessarily worry as much about, okay, am I going to have a fever today? Am I going to have pain today? Like those instances are way more, few and far between. But yeah, vacations, concerts, movies, weddings, you name it, I do it. And additionally, I try really hard to be an advocate for the ostomy community. It's something that a lot of people aren't comfortable talking about, they don't know about. And so if you see me at the pool or on a beach, you will see me in just like a bikini with a little ostomy bag cover that matches. And I treat it like an accessory because it's nothing to be ashamed of and it's nothing to be sorry for. So, I'm living my life again, and there's nothing more beautiful than that.
That's amazing. And first, thank you so much for sharing your journey, not only with us, but live across social media. That's an amazing, it's amazing to hear. And, I hear a lot of your ups and downs, right, through your journey, and making the choice to live with a permanent ostomy it sounds like a very difficult choice at some point, and then became really easy for you to make. But how has it been for you navigating some of those stressors along the way? I'm sure at some point it must have been very difficult, and it sounds like today you're doing really well. So how did you get to that point? Like, how did you learn to navigate those stressors?
Yeah, it's a lot of trial and error. There are things that work and things that don't, and sometimes the best laid plans still don't work in your favor. But I've really come to learn that a lot of it is just being a little bit more prepared. Small things like knowing where the bathroom is. Like it seems so small, but it goes a long way. And now I joke with my friends that that's like my superpower is I can find the bathroom anywhere I go. Or like checking a menu for a restaurant that I may not have been to before, and just, understanding if I have a dietary restriction, is that something that I need to kind of work with, or is it going to be working against me on that day? So again, like there are those small things, but then there are like the little bit bigger things, like if I'm traveling, again, just especially with an ostomy, making sure I have enough supplies with me. I probably pack too many, but I would rather have it and not need it than need it and not have it. And so travel can get a little bit more hairy. But again, it's all in the mindset of this is kind of the reality of the situation, and I can either learn to adapt with it and move forward, or I can stay stuck and be upset. And a lot of, the exercises that were talked about before are things that I've used in the past as well. Not quite the Postit, but I've done a similar exercise where if I have a lot of negative emotions when I wake up one day, or if I'm feeling particularly down, I'll write all of those feelings. Is it anger? Is it sadness? Is it, just grief? And I'll write them on a piece of paper, and I put them in a box, and I put that box somewhere else. And those are the feelings that I need to just kind of shelve for a little while and continue on with my day, because it does weigh heavy. And so you have to find a way to unload it in a healthy way.
Thank you so much for that. Maggie, was there anything that you wanted to add? This has all been so wonderful hearing from both of you.
Yeah, I'm just struck by your story, Marisa, and it just sounds like you've built such resilience through such a challenging journey. And it sounds like something that helps you cope is helping others, and kind of owning that you have an ostomy and all of that. I'm just curious what advice you would have for people who don't have that confidence or voice yet. What would you say to them?
It does get better. And, trust me, this was not something that happened overnight, or I walked out of the hospital after surgery and all of a sudden I was like, oh, I'm like a changed woman. Like it took a lot of time. And, I would say over the course of even the year after my surgery, there were things that I would leave out of the narrative with my friends and family, like things that, you know, and that were involved with the surgery that I wasn't comfortable talking about yet. But I had learned that, you know, my friends and my family are my safe space, and I should be able to tell them these things because, you know, how are we ever going to have an open dialogue with people outside of that circle if I can't even say it to the people closest to me? So it definitely, it is time that helps. And then one of the other, I would say the most beneficial things that I have in my life is therapy. I've been going to therapy for 7 years, and just having that unbiased person to talk to, again, safe space, and they're not trying to placate you with the things that you necessarily want to hear. It's I'm just here to listen, where I feel like sometimes friends and family will offer you more of the, like, it's okay, you're doing great, like, rah, 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 where sometimes you just want to sit there and say, this sucks, like, I'm just not having it, and you just need that ear to listen. So, you know, I would encourage anybody and everybody to go to therapy. It's life-changing.
That's music to our ears for sure. I think, you know, one of the things that I think that Dr. Stoeckel mentioned and you mentioned is like learning to tolerate some of that distress and being able to like communicate that, right? A lot of times we just like stuff that down and we don't talk about it. But it sounds like you found that talking about some of that and just saying like, hey, maybe today's a really bad day and maybe today I'm not comfortable with this has really helped you a lot, and to have, you know, those honest conversations.
Absolutely. No, it changes everything.
And I also want to add that not only is Marisa brave enough to share her story with us over social media and participate in this, but she has been so gracious enough to also be a volunteer for our Power of Two program, which is our peer-to-peer support program, where she's a mentor, so she can help to walk people through, you know, particular times in their life that they might be experiencing difficulties that may be similar to hers. So we are so grateful for you and your support. Is there anything either one of you wanted to add before we close out tonight?
I would say, you know, kind of closing out, during the times when there's a flare or you're not feeling well, like, it's not always like that. It gets better. It may take a while to get there, and it's not fun along the way. But I've definitely learned to be more appreciative of the moments where I can do certain things, like being able to go to the gym every day. That should be like a normal thing, and it is a normal thing for a lot of people, but it's not always like that. And so you learn to appreciate the good days a little bit more.
I like that. I'll also add that, you know, from a mental health side, I think what I always encourage people to do is to ask for help earlier than you even think you need it. I think, you know, when we have a chronic health condition like IBD, it's so important to have that kind of support, whether it's from, you know, a mental health professional as a part of your medical team or something separate. You know, even if you feel like you don't need it, maybe there are things you could learn from it, and even if you don't see that person on a super regular basis, it's really nice to have that person, you know, in your corner if and when you need it. So that's my 2 cents. But it's been so great to talk with both of you today.
Yeah, and I really appreciate that. It just reminds us sometimes we have to be proactive rather than reactive, you know. But I just want to thank each of you for coming today and talking with us about healthy mind and gut and why it's so important. Dr. Stoeckel, thank you. Marisa, a big thank you. And again, a thank you to our sponsor, Takeda, for supporting tonight's program. Just one final reminder as we close out. If you've enjoyed the session tonight, we hope that you'll consider sharing a recording of the chat which will be available on our Facebook page and our YouTube page so that you can extend this information and resource out to others within the IBD community. And then I also wanted to remind you, if you feel that you need additional resources or mental health resources, you can contact our IBD Help Center. Again, the email is info@Crohn'sColitisFoundation.org, and the phone number is 1-888-MY-GUT-PAIN. Well, thank you all for joining us tonight, and take care.